Chapter 36, Targeted Therapies to Treat Cancer. When we talk about targeted therapies, we're talking about specific, deliberate, or cytostatic. The first would be to compare individual proteins in cancer cells with those in normal cells. The second approach would be to identify any mutant proteins that could cause cancer progression. And finally, look for any abnormal chromosomes present in the cancer cells, but not also in the normal cells. Methods of attacking cancer cells would include things like block or turn off the chemical signals, preventing that cancer cell from growing and dividing. Changing proteins within the cancer cells causing cell lysis. Preventing cancer cells from forming new vessels. Triggering immune system to kill cancer cells. And finally, using drugs that are toxic to cancer cells but not non-cancerous cells. Signal transduction inhibitors work to block signals to cancer cells, affecting cell division and causing cell death. They also block signal transduction among specific molecules, blocking both the growth and the spread of the cancer cells. They also work to stimulate immune attacks on the cancer cells. Most targeted therapies would fall under things like angiogenesis inhibitors, epidermal growth factor receptor inhibitors, tyrosine kinase inhibitors, monoclonal antibodies, proteasome inhibitors, and monoclonal antibodies. Small molecule compounds like angiogenesis inhibitors or vascular endothelial growth factor receptor inhibitors work to prevent new blood vessels from forming. They have adverse effects like dizziness, dehydration, weight loss, severe intractable bleeding, GI perforations, compromised wound healing, reversible posterior leukoencephalopathies, and hypertensive crisis, just to name a few. Epidermal growth factor receptor inhibitors inhibit tyrosine kinase indirectly, while inhibiting signal transduction pathways that promote cell division. Side effects would be things like skin disorders, elevated hepatic enzymes, conjunctivitis, abnormal eyelash growth, rash, acne, pruritus, and nail disorders. Osimertinib. This is a newer drug given orally. It's being studied in the treatment of other types of cancer. It has side effects such as pancytopenia, rash, dry skin, anorexia, constipation, nausea, back pain, stomatitis, eye disorders, and cephalgia. When giving any of these drugs, again, we want a thorough baseline assessment about the patient's physical status, lab values, and a special focus on any pulmonary function tests. We also want to keep a careful eye for any clotting disorders and inflammation. We want to also monitor the patient's skin closely, look for any evidence of infection, thromboembolic events, monitor for any signs of perforation, cardiac events, pulmonary complications, and also teach the patient to avoid taking NSAIDs. Tyrosine kinase and multi-kinase inhibitors prevent the activation of tyrosine kinases, which helps inhibit the activation of signal transduction pathways and help stop the proliferation of cancer cells. Side effects would include things like fatigue, edema, electrolyte imbalances, bradycardia, myalgia, constipation, elevated liver enzymes, and hepatotoxicity. When giving tyrosine kinase and multi-kinase inhibitors, again, we want a thorough assessment, especially of any drug or food allergies the patient may have, and keep another close eye on altered clotting as well as decreased immunity and increased risk for infections. We also want to watch carefully for any signs of bleeding, dysrhythmias, decreased cardiac output, heart rate and blood pressure, while also monitoring the IV site frequently for irritation and phlebitis. Proteasome inhibitors. These regulate cell growth, proliferation, and the survival of cancer cells, especially helping to promote apoptosis or death of those cancer cells. We want to watch carefully for anything from GI distress, edema, weakness, peripheral neuropathy, blood dyscrasias, cardiac toxicity, hepatotoxicity, nephrotic syndrome, interstitial pneumonia, dyspnea. These are going to be very toxic drugs. Monoclonal antibodies. These bind to their specific target antigen to inactivate or destroy cancer cells. The adverse effects would be things like headache, dizziness, fever, chills, weakness, hypotension, GI distress, electrolyte imbalances, bronchospasm, hyperglycemia, skin disorders, blood dyscrasias, cardiotoxicity, and anaphylaxis. This is another one. We're going to carefully assess the patient for any drug and food allergies, get a thorough baseline assessment, and keep a close eye for any disrupted fluid and electrolyte balances. We also want to pay careful attention for any cardiac events, assessing for bleeding, assessing their skin closely for any sign of skin breakdown, rash, peeling, erythema, monitoring liver and renal function tests, and also teaching the patient to avoid alcohol and non-essential drugs. For our first practice question, a patient is ordered to receive erlotinib as a treatment for cancer. The nurse would ensure that which assessment is done in monitoring for the most common side effect of this treatment. Would that be A, assessing the eye, B, frequent hearing tests, C, stool cultures, or D, measuring intracranial pressure? That answer is going to be A, assessing the eye. Patients receiving targeted therapies such as imatinib mesylate to treat cancer need to avoid which food? Would that be A, chocolate, B, grapefruit, C, green tea, or D, aged cheese? That answer is going to be B, grapefruit. When administering an intravenous infusion of monoclonal antibodies, which of the following is the most important for the nurse to do? A, restrict the patient's intake of fluids. B, pre-medicate the patient with morphine. C, stay with the patient during the first 15 minutes of the infusion. Or D, assess the patient for the development of ototoxicities. That answer is going to be C, stay with the patient during the first 15 minutes of the infusion. And for our final question, the nurse identifies which statement about targeted therapy for cancer is being true. A, they're more general in their mechanisms and effects than traditional cancer chemotherapy. B, they exert their effects by damaging the DNA of nearly any cell. C, they require a specific molecular target as the recipient of their effects. Or D, they require fewer tests on cancer cells to determine if the therapy will be effective. And that answer is C. They require a specific molecular target as the recipient of their effects. But anyway, that's all we got for this chapter. I'll see you in the next slides.